Hey there, it's Dr. Gould. Just wanted to reach out and talk to you today a little bit about inverted nipple repair. Inverted nipples are actually a common problem. Some of the literature says that it's between 3 and 20%. Newer studies actually that we've published recently show that it may be as high as 30% of the population has some degree of inverted nipples. Inverted nipples, when the nipple doesn't poke all the way out, there are different grades of inverted nipple from 1 to 3, actually 4 in some articles. And those are nipples that can be brought out with stimulation or with cold temperature versus ones that stay inside versus nipples that are completely flat, that have no real nipple. Inverted nipple repair is a surgery, a surgical procedure that we do under local anesthesia, where we basically make an incision at the base of the areola nipple kind of complex, and then we go underneath the nipple, and in a duct sparing procedure, we spread to help release the fibrous tissue that's pulling the nipple down and holding it down while maintaining the ducts that go to the central duct and go to the actual nipple itself. In a non-duct sparing procedure, you actually cut all those materials and allow the nipple to fully avert. Duct sparing is more for younger patients who want to breastfeed or don't know if they're going to breastfeed in the future. Non-duct sparing is for patients that are older that have had procedures done before and that really just want to have a good long-term outcome. Duct sparing procedures have a slightly higher risk of recurrence, somewhere between 9 and 13%, and non-duct sparing is more like 2 to 9%. There's a good article that we wrote on it where we looked at 126 patients and what the outcomes were, and that's been published in ASJ, and I'll put a link to that here at some point. Most patients, what I tell them is that it's a local procedure. You go home the same day. It's really just a day of feeling sore. And then there's a stent that we put on the outside. It's actually sewn to the nipple. That stays on for about 7 to 10 days and has to come out in clinic about a week or so later. There's also a few sutures that are there that are designed to keep the nipple out, and those stay in a little bit longer and get removed in clinic. Expectations for surgery should be that within a few days the pain is gone. After the stents come out, within a few weeks the nipples are looking good and healing. You have to be careful and continue to wear nipplettes and retractors that keep the nipple out during the healing process for somewhere around 3 months while the nipple fully heals. The scar tissue on the inside can always come back and pull it in, and we want to avoid that in the early stages. Grade 3 are more difficult course, and you have to be extra careful with those. Sometimes leave the stents in longer. Can recur, and when it does recur, the option is to do another surgery. When we do another surgery, we're doing the same thing. So you have to be really careful not to expect a different result with the same maneuvers, but we do leave the stent on longer and we are a little more aggressive. So if I did a duct sparing, then in the second one, we wouldn't do a duct sparing approach. So sometimes that requires that the woman decides, hey, I'm going to wait, have kids, and then come back and do this. Another important thing to know about the surgery is that it's not just everting the nipple, it's also making an incision in the muscle that's in the nipple itself to help release some of the tension that's created that contributes to the nipple inversion. The other thing that's important to mention is that around 30% of women have difficulty breastfeeding with or without inverted nipples. And there's no guarantee that even with a duct sparing procedure, a woman would be able to breastfeed in the future. Inverted nipple repair is a procedure with great success rate, high satisfaction rate, can be done under local anesthesia, and addresses a lot of the issues that patients have regarding their nipples in general. And in our practice, we do several hundred of these, a year, because there's just a lot of patients that come to us because of the articles that we've written on inverted nipple repair. I hope this answers some questions about inverted nipple repair, about expectations. Usually I have patients come in for a pre-op appointment in person. We sit down and we talk at length about the procedure and what their expectations should be, and then go over any really specific questions that they have. Again, it's a procedure that's pretty well tolerated, very comfortable, and gives a pretty good lasting result. If you have other questions about inverted nipple repair, let me know here or contact the office and we'll chat with you a little bit more about it. Hope you're having a good day. Talk to you soon.